Hello and welcome, my friends. I'm Dr. Saptarshi Banerjea, and it's a happy day for me today as it's my daughter's birthday, 11th of June. And I'd like to share with you another one of my very interesting and important topics is increased cholesterol and triglycerides and lipids. I'm taking you back to my series on common ailments, and this is one of the parts of the common ailments which is plaguing the urban population, which is increased cholesterol, increased triglycerides. Many times patients come to you perhaps with no symptoms, asymptomatic, and they will tell you, my major concern is the raised cholesterol and triglycerides, and could you help me with it? And I don't want to revert to conventional medication and the side effects of it. So obviously constitutional remedies will always help you to bring down those levels, but sometimes you need these homeopathic organopathics to help you in that pursuit to bring those levels down. And again, in the 21st century, when you want to withdraw the conventional medication, organopathics are a way forward to help you in achieving that successful results. So without any further delay, I'd like to introduce you to my first remedy for increased cholesterol and triglyceride levels, or increased lipids, which is Sambul. I've had massive success, my friends, with this wonderful remedy, which is Sambul. Sambul is also known as Musk Root, and you can understand its relation to musk, which is muscus. So many times what happens that it has an odor which resembles musk, and Sambul is used as a substance which to adulterate musk as well. So as it's musk root, so it can be sometimes used to adulterate musk, because musk is a very expensive compound. Now if you consider its name musk root, and hence it bears close resemblance to muscus. So three major criteria of Sambul: you'll find they are hysterical, you'll find they have nervous palpitation, and you'll find they can have easy fainting. So again, fainting is a common feature of muscus. You'll also find that feature in Sambul as well. So they are hysterical, they have nervous palpitation, and they have easy fainting as well. Now if you think of these in perspective of high cholesterol and triglycerides, one of the things you can find very common is nervous palpitation in menopausal women. So in menopausal women there is nervous palpitation. You will find they are hysterical, because many times you will find insomnia as well. So even if blood pressure levels are normal, blood pressure levels are high, but patient is suffering from insomnia with increased cholesterol, with increased triglycerides, think of Sambul. And many times, because of the hysterical nature, you will find aggravation thinking of complaints as well. So whenever they are thinking of the palpitation increases. So aggravation thinking of complaints is also an important factor for Sambul as well. Now if you concentrate specially on the cardiac characters for Sambul, you'll find many times in Sambul that there is a clogged feeling in the left chest. So if you consider the cardiac features, there is a clogged sensation in the left chest. Many times, because of that clogged sensation in the left chest, there is a numbness which goes down to the left arm. So numbness in the left arm as well. Clogged sensation in the left chest. There is a numbness in the left arm, and they are worse from exertion as well. So exertional dyspnea, the out of breath, they're breathless when they're exerting. So that's an important factor for Sambul, and well, that's why it becomes a celebrated remedy, my friends, for cardiac asthma. I'll compare Cratigas in a moment. I know I've always shared with you, always try to compare with remedies which are important in practice. So coming back to Sambul, as a musk root remember it resembles muscus. So all those anxious subjects, all those hypochondriac subjects who are really concerned about the cholesterol and triglycerides, perhaps it's on the borderline, but they're still so much concerned, they're so much anxious about it, they're losing sleep over it, they're getting insomnia because of the stress, because of the anxiety. So those hysterical subjects, patients won't come and tell you that I'm hysterical, but you'll understand that they have the anxiety, they have the hypochondriac nature, that they're worried. It's just, cholesterol is just borderline, but they're worried, what if I get a heart attack? And those subjects will respond well with Sambul. When they have insomnia, whenever they think about the palpitation increases. Nervous palpitation, menopausal women who are having hot flushes, climacteric flushings with those palpitation, you can think of Sambul. So that's a nervous palpitation. The anxiety triggers the palpitation as well in Sambul. And if you consider the cardiac aspect, a clogged sensation in the chest. a numbness which is radiating to the left arm. And again, thinking of complaints always makes them worse. Exertion, even physical exertion, makes them worse. That's why I mentioned it's a very important remedy for cardiac asthma. I've used Sambul with great results in cases to bring up the ejection fraction. You'll find in the echocardiogram, you have to acknowledge that many times the urban population are more concerned about their reports than their symptoms. And you have to go with the changing times as well. So many times if the constitutional remedy doesn't give you the desired results, Sambul will. It helps in bringing up the ejection fraction. It helps to improve the motility, the contractility of the heart. And that's why in those anxious, hypochondriacal, hysterical is a far-fetched word, but in those hysterical subjects, Sambul will be of great benefit, where the emotional component triggers the palpitation, thinking of complaints, even the physical aspect, the exertion triggers the palpitation or the breathlessness as well. A clogged sensation like cactus, but again, you see the emotional aspect you won't find with cactus, the anxiety you won't find with cactus, and there's a numbness which is radiating to the left arm, which is also missing in cactus, my friends. So Sambul, preferably mostly in tincture, 10 drops twice a day, at least continued for 4 to 6 weeks to see its best results. 10 drops twice a day, at least for 4 to 6 weeks to see its best results. And remember its correlation with Moschus. Now, as we considered Sambul, the remedy which comes close, and to understand the comparative Metromedica, which I so much love and which I work in my mind, that why Sambul, why not Crataegus? And here lies the answer. Number 2 in our remedy for increased cholesterol and triglyceride levels is Crataegus. I'm sure you know and use Crataegus, but if you consider the areas for Crataegus, it's obviously one of the remedies which is directly mentioned in Borica's Metromedica for cholesterol and triglycerides. Why? Because there's a line in the introduction of Borica which mentions that said to have a solvent action. If you read Borica's introduction, said to have a solvent action upon the crustaceous and calcareous deposits in the arterioles. So it dissolves the crustaceous deposits, it dissolves the calcareous deposits. So arteriosclerosis respond well with Crataegus. So increased lipids is my first point for Crataegus. How is it similar to Sambul? You have dyspnea from exertion in Sambul, you have dyspnea from exertion in Crataegus as well. So that's a common feature between both the remedies. You will find insomnia in Crataegus as well. But what's important to understand, for Sambul, the insomnia was with anxiety, was with that hypochondriacal nature. But in Crataegus, the constitution is more of an irritable nature. Extremely irritable in case of Crataegus, and there is a line in Crataegus that it's a sedative in cross-irritable patients. So the insomnia is more in irritable subjects, whereas in case of Sambul, the insomnia was more in anxious subjects, and that's one of the very important clinical differences. Next, if you consider the differences between Crataegus and Sambul, you'll find in Crataegus there is a tender spot in the left side of the spine. Tender spot in the left side of the spine. So in the back they will say it's a tender spot. You touch it and it feels tender to touch. So that's important as well. Many times an important factor for Crataegus is air hunger. So need air. I need lots of air. So air hunger is an important factor as well. You can find cyanosis to a certain extent if that pathology has progressed. So blueness of fingers and toes, cutaneous chilliness. You'll find the coldness, the blueness in Crataegus as well. But even if you don't get that, air hunger is an important factor. They always need fresh air in patients with increased cholesterol, increased blood pressure. In Sambul, the blood pressure can be normal, can be high, whereas lipids are high. In Crataegus, generally, it's a combination of lipids plus HDN. HDN is hypertension. So the combination of high blood pressure with increased lipids makes a difference between Sambul and Crataegus. Crataegus, the blood pressure is always generally high, so that's quite important as well. And lastly, for Crataegus, you'll find hypertrophy of the heart. When you do an echocardiogram, when you do an ECG, you'll find there's a cardiac hypertrophy. What can cause that? Exertion can cause that. So if you are involved in lots of physical activities, physical labor, you can have the hypertrophy. Even alcoholism can cause the hypertrophy in Crataegus as well. So that's also quite important to understand for Crataegus. So you see, it comes close to Sambul because both can have an affinity for increased lipids, increased cholesterol. It comes close to Sambul because you can have exertional dyspnea. It comes close to Sambul because you can have insomnia, but remember Sambul is a hysterical, hypochondriacal, anxious subject, whereas Crataegus, gets irritated with the blood pressure, increased blood pressure. So that's important to understand for your Crataegus. Hypertrophy is an important aspect. As I mentioned, exertion can cause it, alcoholism can cause it. Air hunger, the need for fresh air is also important for Crataegus. And many times patients may tell you that it's a tender spot in the left side of the spine. Remember, Sambul, it's more left chest and left arm which is clogged and there is numbness. Whereas in case of Crataegus, it's more the left side of the spine which is more tender. Again, for Crataegus tincture, at least 10 to 15 drops twice a day, continue for 4 to 6 weeks. Any of these organopathics which you're using for lipids, at least use it for 4 to 6 weeks, then do a repeat blood test to see what are the changes observed. My number 3 in this list, another very interesting and underrated remedy which is not often used, is Baryta muriatica. Baryta muriatica has been mentioned in many literatures for atherosclerosis and arteriosclerosis. So with Baryta mur, the subject is generally an elderly subject. What is an important feature in Baryta mur is you will find there is glandular enlargement. So many times the parotid gland can be enlarged. Glandular enlargement is an important factor. So the parotid gland can be enlarged in case of Baryta mur. What is also quite interesting for Baryta mur, you will find aneurysm. Aneurysm is dilatation of the arteries. That is also an important factor for Baryta mur as well. So elderly subject. And if you think of Baryta symptoms, they have poor memory, profuse salivation. So these are Baryta group of symptoms. You find mostly in Baryta carb, but Baryta mur as well. And the glandular enlargement here is mostly the parotid. The right parotid is enlarged and hard, and that glandular enlargement you will find in Baryta mur. But what tops that list, what differentiates Baryta mur with every other remedy is, remember, a high systolic and a low diastolic blood pressure. High systolic, low diastolic blood pressure. With Crataegus, I mentioned it's generally hypertension, but this variation in blood pressure is the characteristic of Baryta mur. High systolic, low diastolic, so 180 by 60, 170 by 50. So that kind of high systolic, low diastolic in a patient with atherosclerosis, in a patient with glandular enlargement, preferably parotids, in a patient who has salivation, in a patient who is poor in comprehension, poor in memory, in a patient who probably has an aneurysm, abdominal aneurysm, any other aneurysm which can be found in different organs without any symptoms, and Baryta mur helps such cases. Baryta mur is available generally in triturations, so 3x, 6x triturations or in tablet form. Baryta mur can help you to handle cases of atherosclerosis as well as arteriosclerosis. My number 4 in this list is another very interesting remedy, and that, my friends, is Guateria gaumeri. Guateria, you won't find it in Allen's or Boriquet or Clark's dictionary or Julian's new remedies or Julian's rare remedies. You will find mention of Guateria gaumeri. Guateria, my friends, is a very interesting remedy because, remember, it's a combination of lycopodium and chelidonium. So when you find high cholesterol triglycerides in a patient who has some lycopodium, some chelidonium symptoms, think of Guateria gaumeri. How is that? Both lycopodium and chelidonium are right-sided remedies, and so is Guateria, right-sided. So congestion in the liver, the base of the right lung is affected, and that is the case for both lycopodium and chelidonium. The base of the right lung is affected. Both have a strong involvement for the hepatobiliary system, and so does Guateria gaumeri. Many times if you understand the pathophysiology, why increased cholesterol and triglycerides develop, one of the major factors is definitely derangement of the liver, and Guateria addresses that functional factor to help rearrange the liver again. So hepatobiliary action on the liver, gallbladder which is deranged, right-sided preponderance, so right-sided liver, right lobe of the liver, congestion in the base of the lung like chelidonium, like lycopodium, that is an affinity for Guateria gaumeri. Now if you consider symptoms related with lycopodium, Like Lycopodium is better from belching, your Guatteria is also better from belching. With Lycopodium, you will also find they have a desire for sweets, desire for warm food. But here in Guatteria, it's the opposite. They're worse from sweets. They're worse from hot food. So the palpitation increases from hot food. The gastric issues increases from hot food. So even it is related with the cardiac system, that sweets makes them worse, hot food makes them worse. So although it is similar to Lycopodium with the desire, with the better from belching, but it's reverse with their food modalities, with their food craving modalities. Now with Chelidonium, you can find always a yellow coating on the tongue. So does Guatteria have a yellow coating on the tongue. Chelidonium has a lot of liver spots, so pigmentation on the face. Guatteria also has a lot of pigmented spots on the face. Remember, Chelidonium works really well when you have liver spots, lots of dark brown spots on the cheeks, forehead, and Chelidonium can clear that. Guatteria also has an affinity for those kind of liver spots or pigmentation on the face. But again, it is different to Chelidonium because Chelidonium is generally better from eating, whereas in case of Guatteria, they're worse from eating. So again, the palpitation gets worse from eating. The liver symptoms the cardiac symptoms gets worse from eating. So in that way, it is similar yet different to Chelidonium. And also, what's important with both the remedy, with both these and with Guatteria, that there is a strong aggravation when lying on the right side. So although it's a right-sided remedy, but there is a strong aggravation when they lie on the right side, and that's also quite important for Guatteria gaumeri. So remember, a patient with high cholesterol and triglycerides, with atherosclerosis, who has some Lycopodium symptoms, predominantly right-sided, right side of the liver is involved, right lobe of the liver is involved, congestion in the base of the lung. They will tell you, I like sweets, I like hot food, but unfortunately it doesn't like me back. I get gastric issues, I get palpitations from sweets, hot food, and that is Guatteria. Although I'm better from belching like my parent, Lycopodium, but I don't agree with sweets and hot food. Chelidonium is my younger brother who has similar liver spots like me, who has similar yellow coating on the tongue like me, but like my younger brother is better from eating, unfortunately I'm worse from eating. But I share my family heritage because I have an involvement of the hepatobiliary system. I share my family heritage because I'm right-sided and my base of the right lung is affected. But I'm also worse lying on the right side as well. So that's an important factor of Guatteria gaumeri. It's prepared from the tincture of the dried bark of the plant. So it's absolutely natural product, and again in tincture, 10 drops twice a day, continue at least for 4 to 6 weeks. When you come across atherosclerosis in a Lycopodium or Chelidonium or a hepatobiliary constitution, and that's important. You have to understand again, Crataegus, Sambul were more affection on the cardiac plane, whereas you have to understand the sphere of action here. Guatteria has an affinity more on the hepatobiliary plane. Baryta mur is more a geriatric remedy with involvement of the glands, with involvement of the aneurysm, and the comprehension skills are also affected in Baryta mur. Fifth in this list, a remedy which I'm sure definitely most of you know in the Indian subcontinent, is Terminalia Arjuna. With Terminalia Arjuna, what is important, many times you can get low blood pressure. So low blood pressure with atherosclerosis responds well with Terminalia Arjuna. Remember, that's the difference with Crataegus. Crataegus is always hypertensive, whereas Terminalia Arjuna can have low blood pressure. One of the very important factors about Terminalia Arjuna, that it is also a remedy where there is weak heart. So many times patients have an autoimmune disease, or patients have different multisystemic conditions where the heart is affected and the heart is weak due to a complicated disease. So weak heart due to a complicated disease. With patients with hyperthyroidism where there is tremendous palpitation. So the weakness of the heart is as a consequence of a complicated disease. So low blood pressure with atherosclerosis. You know, Arjuna bark has been used for thousands of years in the Ayurvedic literature for cardiac complaints. Patients, you know, people used, even still do in the Indian subcontinent, they take the bark of the Arjuna tree and they dip it in water and drink that water, and that's very good for the heart. Terminalia Arjuna, used in Ayurvedic literature, also used in homeopathy. You will find in the Indian drug section of Boric that low blood pressure with a weak heart and even atherosclerosis, Terminalia Arjuna responds really, really well. Again, same way, 10 drops twice a day, at least for 4 to 6 weeks. Terminalia Arjuna is referred many times as a wonderful injury remedy. So in cases of ecchymosis, in cases of fractures, many times in the Ayurvedic literature they used to use Terminalia Arjuna to reduce the pain, to reduce the ecchymosis as a consequence of the fall, and helps in absorbing the blood, in absorbing the hematoma as efficiently as your arnica. So also think of Terminalia Arjuna in such cases of injuries as well. But if you consider cases of weak heart with low blood pressure with atherosclerosis, Arjuna is your go-to remedy definitely in tincture. And my last remedy for the day for cholesterol and triglycerides, which works wonderfully, and I've used it in the recent past as well, is Alium Ursinum. Alium Ursinum, my friends, is a wild garlic. Most of you perhaps have heard of Alium sativum. Alium sativum is the natural garlic which you'll find in Borica's Metromedica. But Alium Ursinum is the wild garlic. Again, it's readily available. You can Google it up, and wild garlic has an equally efficient benefit in atherosclerosis. Alium sativum works well in cases of hypertension with atherosclerosis. But many times if you don't have hypertensive symptoms but the patient is just having atherosclerosis, think of Alium Ursinum in such cases with the Alium group of symptoms. What are the Alium group of symptoms? You have to understand here for Alium Ursinum that it is a remedy which bears very close resemblance to Nux vomica. That is the case with Alium sativum as well as with Alium Ursinum, that it bears strong resemblance to Nux vomica. Why is that? Because it is a remedy which is useful for the non-vegetarians, so who are meat eaters, who are gorging on meat. So those constitutions respond well with Alium sativum and well as Alium Ursinum. I answered the question first itself. Why not Alium sativum? Because Alium sativum is hypertension with atherosclerosis. But Alium Ursinum can be prescribed in cases where you have Alium symptoms but no hypertension, but atherosclerosis can be controlled with Alium Ursinum. So meat eaters, so that's a very important factors for Alium Ursinum. Strong constitution with firm flesh, strong constitution with firm flesh and dark complexion. Dark complexion may not always be the factor, but strong constitution, firm flesh, again resembles Nux vomica. Nux vomica is generally thin, emaciated, rigid fibers. That's what you find with Nux vomica, Bryonia, that group of remedies, and such is also the case with Alium Ursinum as well. Alium sativum, Alium Ursinum are always referred to as gourmands who love to eat, who love eating tasty, good food which is good for the palate. They're not gluttons. You'll find the word gluttony mentioned with Antim Crude. Antim Crude has a tendency for overeating. So Antim Crude is a glutton. Whereas in case of Alium sativum, Alium Ursinum, they are more gourmands than gluttons who love tasty food which is tasteful for the palate. Many times, like Nux vomica in Alium Ursinum, you will find impatience. They don't know when I will get better, when will I recover, when will this happen. So there is a constant impatience. I feel I won't recover. And that impatience which you find so much with Nux vomica is also reflected in case of Alium Ursinum as well. Many times, like Nux vomica, you can have a gastric headache in Alium Ursinum. And that is also another important factor for Alium Ursinum. There is a heavy head, they cannot keep the eyes open, so the gastric aspect is very important for Alium as well. Like Nux vomica, you will find there is deranged bowel movement. So either there is constipation, either there is loose stools, so deranged bowel movement. And why is that? Because of irregularity of diet. Like Nux vomica, the meal timings are not correct, not regular, so there is irregularity of diet, and that irregularity of diet causes the derangement of the bowels. So chronic dyspepsia. So again, another factor is chronic dyspepsia. With deranged bowel movement, with irregular bowel movement, which is caused by the irregularities of the diet. and that is also very important for Alium ursinum as well. You know, garlic has been used in ancient times as a condiment, and garlic is really good for the bowels and the digestion, and so that's also an important factor for Alium ursinum. So you see, many times with Alium in the modern day world, it is a reaction. The atherosclerosis, the high cholesterol and the lipids is a reaction to what we call as high living. The modern day high living, which you find with Noxomica so much, and which causes the lifestyle diseases that is found with Alium ursinum. Why? Because there's so much meat eaters eating red meat so much. They're having irregular diet habits. They eat a lot, gourmands, and that is resulting in the chronic dyspepsia. So chronic gastric issues, that is resulting in the deranged bowel movements, irregular bowel movements. That is resulting in the gastric headache. So the gastric symptoms follow the path of Noxomica, but the patient is consulting you not for his gastric issues, because there's not much gastric issues perhaps, but for his atherosclerosis, and you find the constitutional picture typically like Noxomica. And if Noxomica doesn't help you, obviously you start off with the polycrust. If it doesn't help you, to always think of Alium ursinum to be at your rescue. Alium ursinum, as I mentioned, in tincture, 10 drops twice a day, continue at least for 4 to 6 weeks as well for Alium ursinum. So I shared with you 6 top remedies which can help you to counteract increased cholesterol, increased triglycerides when the patient is dependent on conventional medication, taking it time and again. And remember, with these organopathics, you are still following the 3 basic principles of homeopathy: similia, simplex, minimum. You are prescribing the single remedy, you are prescribing in a minimum dose 1/10, and you are giving it based on the totality and the similarity of symptoms, however concise the totality may be. And even with these organopathics, you can gradually wean off the conventional medicine. You ask the patient, whenever he is dependent on continued cholesterol medication, you ask the patient, reduce that conventional cholesterol medication, reduce it to alternate day, reduce it to once in 2 days. So reduce 50% of medication and introduce these organopathics so that you can gradually wean off the conventional medicine. I'll talk about how to wean off conventional medicine in another section, but these remedies are really helpful and has helped me in my practice, helped to grow my practice, especially when the urban population is so much concerned in today's world with reports rather than symptom pictures, which is unfortunate. But many times if you don't get a clear constitutional picture, many times I prescribed an Noxomica, it didn't help me. Alium ursinum did. So you must know all your weapons which is at your disposal and know when to use them and how to use them. Thank you very much. Long live Hanuman, long live homeopathy.